Hi, I'm Dr. George Gonzalez, and as one of the family physicians here who practices obstetrics as well, I have the privilege of seeing women from birth to well after menopause. And one of the most controversial subjects that we have encountered in medicine has arisen from a study done beginning in 2002 called the Women's Health Initiative. In that study, there were some conclusions that hormones could not be as good for you as previously thought, in fact, harmful, leading to an increased incidence of breast cancer, heart disease, blood clots, and strokes. And so there was quite a big stir in the community, as well in the medical community as well as in the public community, that is just now settling with better recommendations and answers. So I'd like to address that. The big question that women have for us is, should I take hormones at all if I am having hot flashes and going through menopause? And our answer, for the most part, is maybe. For the most part, the recommendations be made on an individual basis by your primary care physician. But I can give some general recommendations. If you are healthy without any history of heart disease, breast cancer, or blood clots, then you are a candidate to take hormone replacement if you begin having hot flashes. And there is nothing that works as well for hot flashes, vaginal dryness, and some of the other sleep disturbances that may occur with menopause as the treatment with hormone replacement. The evidence has shown that for the first 5 years of use, there is probably no increased risk. But after 5 years, the combination hormone therapy of an estrogen plus a progesterone does increase risks of breast cancer, heart attack, and strokes. Now, the study that was done to prove this was a study of 160,000 women. So to individualize the risks and try to assess your personal risk on an individual basis, a woman may have as much as 0.1% increased risk after 5 to 10 years of any one of these things occurring to her. So it's a very small risk on an individual basis. But per 10,000 women, it was shown that 8 more women acquired breast cancer than those who did not take hormone replacement. 7 more women had heart attacks and strokes, and 18 more women had blood clotting problems, deep venous thrombosis. So there is a significant risk that does occur the longer you take it. So our recommendation is that if you do have significant symptoms of hot flashes and the like, that you consider taking the lowest dose possible of an estrogen progesterone replacement, and you, after 1 to 2 years, reassess your need and see if you can wean off those hormones over a period of 4 to 6 weeks. And if you no longer have the hot flashes, then you can get off of them. We also know that the hormones were given for other reasons, including for bone health, to preserve your bone strength and prevent osteoporosis, and even for colorectal health. The WHI study did show that there was 6 less cases of colorectal cancer and 5 less hip fractures per 10,000 women who took these hormones. So there's that benefit. But there are other medicines that can serve for your bone health and colorectal needs. So we do not recommend these medicines for that. The big turnaround was that we always thought these hormones were good for heart, and they are not being recommended any longer for any prevention of heart disease, since we have the study has proven the opposite to be true. If you have had a hysterectomy where you do not have a uterus, you do not need progesterone combined with your estrogen for your hormone replacement. And we have seen that estrogen alone does not prove to have an increased risk of breast cancer or heart disease within the 7 years that it was studied. So we feel a little bit easier with giving estrogen alone for women who have had a hysterectomy. However, we still recommend after 5 years that you consider discontinuing this if you no longer need it for the menopausal symptoms already discussed.